Hi there, and welcome to the Ready, Set, Change podcast. My topic today, I'm going to be talking a bit about trauma and whether or not trauma and change are synonymous and what we can do to help people who are experiencing trauma from the pandemic move back into their workplaces in a cohesive way. I'm April Callis-Birchmeier. I'm a certified change management professional and project management professional. And on this episode of Ready, Set, Change podcast, I'll be really just discussing my thoughts about this issue. Recently, an article in the Harvard Business Review was written by David Rock. And David Rock is somebody that we know in the Association of Change Management Professionals. He is the co-founder and chief executive officer of Neuro Leadership. And he talks a lot about how brains function, how our neurons fire, and how all of that interacts with change. And what David stated in his most recent article, and I will put a copy of the article in our episode, with our episode for the podcast. But in the article, David talks about running and how he enjoys running. And yet one day he was running and rolled his ankle, and the trauma of his ankle injury took a long time to heal. And he thought about this trauma and how it impacted his life because he couldn't run. And he compared it to the situation that many of us find ourselves in now, which is that the pandemic is ongoing and has never really ended for many of us at work. And the question that he posed was, do we need time to recover from the trauma of the pandemic, just as we need time to recover from the trauma of an injury? And I spoke with my ACMP chapter, my Association of Change Management Professionals Michigan chapter, about this exact topic. And I had a couple of thoughts about it, and I wanted to share them with you and hear what you think about these ideas. You know, on one hand, I have a little bit of a struggle with the word trauma because I've worked in healthcare, and the trauma team was called whenever we had a serious emergency, a serious injury coming into the hospital. Many times they were being airlifted to the hospital. So I think of it as a very serious physical or emotional injury. And so I wasn't sure if I wanted to identify the change that people have been through, this situation, as trauma. And yet I do know people who are focusing on the trauma of change. And so it leads to kind of an interesting chicken and egg thought, right? Is it better to refer to change as trauma and then institute some of the steps that we take to recover from that trauma? Or do we recognize that change is hard? It can feel traumatic, and that's why we have organizational change management. I mean, are the two combined, or are these separate pieces? And I think it's really a difficult and interesting conversation to think about. I heard a lot of examples about this recently. I've heard of people who were working in the office, and the next day they were not, and they still have not gone back to their offices. And they are starting to feel that this chronic lack of changing back, the chronicness of the remote work is difficult for them, and has actually changed from sort of a shock to the system as a trauma is, to being sort of a chronic condition, a chronic ongoing pain, which, while it certainly is different than a shock, an immediate injury, the chronic injury, the chronic pain can almost be more damaging over time. And so I heard from somebody talking about that consideration. I've also heard from people who talked about moving into remote work and then having to, without their wanting to, return to the office and having to go back into a physical office. And they don't want to be in a physical office. They'd prefer to be working remotely. And is that a trauma to them, that they have to now go back to what they previously had, but they don't want to be back in that previous world? I think of my own situation. I was working with people in an office, consulting with clients, and then I also was self-employed. So when the pandemic came, I was now completely self-employed and no longer saw clients at all. I reached out to fellow consultants and experts, and I actually did, in the first 3 weeks of the pandemic, I created a work from home summit where I interviewed a number of individuals: Chris Johnson, Lori Brown, Jason Veladis, sorry, from TechSmith. I interviewed a number of people about how to work from home and how to work remotely. But once that project was done, I did feel very much alone. I don't think I felt traumatized because, of course, I had a really privileged opportunity to stay home in my home office and be able to still work. Whereas there were a lot of people like my daughter, who was a waiter at the time because she's an actor. And at that time, all of the restaurants closed down and there was no work at all. So it's very interesting to think about, is this traumatic? And if so, what do we do to heal? How do we heal ourselves? How do we come back from this? And is it possible to come back from it? I heard that, not dwelling on what we used to have, not dwelling on how things used to be when we were in the office, is a first step to coming back from this sort of injury or traumatic event. Is the recognition that things will be completely different going forward. I think that's what happens many times when we do have a physical injury as well. We may never recover the functionality that we had. We may never be pain-free the way that we previously were. And so I think it's an important recognition that the discomfort of change, the impact of change can many times be lasting, and it lasts much longer than the initial event. So when I think about David Rock's column, when I think about his article that he wrote for Harvard Business Review, I don't know 100% if I'm on board with the thought about this is a trauma to us. But I also have to say that I am 100% on board with the recognition of the pain that this remote, half remote, sometimes not at all, job loss, job change, friendship interrupting, pandemic environment has had on all of us. And I think that there's a lot to be determined as we go forward. And we hope at this point that we're reaching sort of an end point where we can live with the coronavirus, with COVID-19 being kind of always present. But I'm sure as different variants arrive, we'll see differences as we go forward. I do think it is worth a very interesting conversation with your loved ones, your partners, and with those you work with, because it is hard to maintain and adapt in this chronic situation. And it's also difficult to sustain that shock. And it's really important to figure out ways to protect ourselves and protect our functionality, protect our function as we heal through this event. So those were some thoughts I had about change and about trauma. And as I said, I will link the article, and I'd love to hear your thoughts as well.